Hi everyone. Haven't posted in a long time, but I've been gathering myself. I'm back at work, but I wanted to, I felt compelled to really have this conversation today because of, some things that I've been going through over the past few weeks. I really was feeling quite ill, and one of the things that I learned is that we all have to advocate for our own health and well being. I was really sick, went to the emergency a few times, went to my family doctor, and I was not really getting the care that I needed. I was really, being treated for the symptoms. The underlying problem was not being addressed. My family doctor, in spite of her willingness, obviously she's not a specialist for everything, and so in spite of her willingness to care for me, she wasn't able to. And I'd go to the emergency room and they treat the symptom. I tried very hard for successive attempts really at meeting my oncologist, and his nurse just didn't think the situation was urgent enough, and so she didn't give him the messages, and so I had to rely on the emergency room to treat me. But I knew something was wrong. I know my body very well, and I'm not a crybaby, and so I was being made to feel like I was a crybaby, like what I was going through was normal, but I 100% knew that something was very wrong. And it was not until I was able to reach my oncologist and he was able to have conversations with some other specialists and to review my file in the way it needed to be reviewed, which is in the context of a breast cancer survivor who is being treated in a particular way. Until then, I was not able to get ahead of the situation. Today is the first day in, I would say, 16 days that I've actually felt myself. And so I just felt that I needed to share this message that, don't be put off by others who have opinions about your health situation. You know your bodies, and you should take accountability for that because no one knows exactly how you're feeling. And especially in Canada, where we have social insurance, the system can be quite, I would say, clogged. That we have long waiting lists because everyone has access, which is really good. So that there are pros, but the cons to that is that you have to wait a really long time. You have to navigate multiple specialists to get the kind of care that you need. So my advice to you is listen to your bodies. You know your body. You know when something is wrong. Listen to your bodies. Advocate for yourself. I pestered people until I was able to find out one person who had empathy for my story, who really believed that something was wrong, and when I finally got through to my oncologist, he had not gotten the messages. He did not get the messages, and he apologized for that, because the nurse just thought that I was exaggerating my symptoms. She thought nothing was wrong, despite what I was telling her. And so when I finally got a hold of him, through sheer persistence, I would say, just not giving up and knowing that he needed to be involved in the discussion, not until then was I really able to get the kind of care that I need. So don't apologize for advocating for yourself, for being persistent, for pestering people. When you're going through something and you're going through that, you know exactly what it is. You know what your body is going through. Listen to your bodies. Advocate for yourselves. and don't ever apologize for wanting to take care of yourself.